Gundersen cancer researchers in La Crosse are still tracking COVID-19 spread to try to understand the virus better. Ever since News 8 Now started following the research through Gundersen Health System, it gained national attention.
And their work is so accurate, it can track the virus all the way back to its start in China. News 8 Now's Jordan Fremstad has this update.
One of the big lessons from this is how connected we all are.
Gundersen's Dr. Porak Kenny is one of the researchers in charge of a project tracking the sources of COVID-19 spread in the La Crosse community. It's the same technology used to track disease in food, like E. coli in salad. They are remarkably accurate.
That has allowed people to really track down to individual farms where these diseases are spreading from.
In case you missed our explanation on how this research works,
before it can infect somebody else, it needs to make many millions of copies of itself. And to do that, it makes copies of this genome. Usually it does that really well, but occasionally it makes a spelling mistake.
Those mistakes allow them to create a map of something the naked eye cannot see. Obviously, it's much easier to control something doctors can see. Ever since we started following Dr. Kenny's team research using genome sequencing, this work is catching people's attention coast to coast, everywhere from the Washington Post to the Los Angeles Times, even Time magazine. Their work earned respect.
We've sequenced 750 genomes from the coronavirus from our local population.
That's 2% of this research happening nationwide. However, it's what this research reveals that matters most to a man with decades of experience in cancer research, starting with a meatpacking plant in Postville, Iowa.
We were able to detect coronavirus spread from that outbreak across the 200 square mile area of Wisconsin.
And the outbreak in September from college campuses. 27 of La Crosse County's 32 deaths have happened since the start of October. If you think you can't impact other people, allow Dr. Kenny's map to explain how it definitely can.
2 people brought the virus to our region.
This example started with a group of college students.
3 individuals shown just here, but from there moved into one of our nursing facilities in town, affecting about a dozen people that we've been able to sequence, including 3 deaths. 1 death is too many.
People can make a different choice today.
Just because we went to a bar last week doesn't mean we have to go to a bar this week. It's not just about this Thanksgiving, it's about all the Thanksgivings to come.
Reporting in La Crosse, this is Jordan Fremstad, News 8 Now.
And Dr. Kenny says small gatherings in people's homes have his attention right now because he says those gatherings are most likely driving the current spike the community has seen over the past 2 weeks.